Out of the more than 1 million people who are HIV positive in America, 1 in 4 is unaware of this potentially life-threatening fact. Plus, almost 40% of those with newly diagnosed AIDS discovered that they were infected with HIV less than 1 year before diagnosis. These and many other sobering statistics have caused the CDC to revise its guidelines, making HIV testing routine for patients between the ages of 13 and 64. Using this opt-out approach, patients must specifically ask not to be tested for HIV, resulting in a much higher rate of testing among all populations. This new approach, adopted in 2006, does not require separate written consent or pre-test counseling prior to testing for HIV. Verbal consent is sufficient. Under these new guidelines, universal routine testing increases the probability of early HIV detection and treatment. Testing for those who do not opt out can be done either by a standard blood draw venipuncture or a rapid test. Regardless of the testing methodology, CDC opt-out screening has a few simple steps which go as follows.
Good. We're going to be running an HIV test on you today as part of our standard blood work. You can decline the test, but we really do recommend it as an important part of your health care.
Well, I guess it would be good to cross it off my list of things to worry about.
For sure. The rapid test only takes about a minute, and you can have your results in 15 minutes. But I see here you're having other labs conducted, and we'll have blood drawn already, so we can include it with the other tests and then have your results in 5 days. Which do you prefer?
The rapid test works for me.
Great. I'm gonna have to just prick your finger, get a little blood.
Will it hurt?
Just a little pinch, nothing too painful. And then the doctor will come in and give you results. Ready to get started?
Yeah.
Here, the medical assistant encountered little resistance. But not every patient will say yes the first time they are asked.
Hello, Mr. Hernandez. I'm Dr. Chang.
Hi.
Good to meet you.
Pleasure.
You know, I see today that you chose not to have your HIV test done, and you know, it's recommended that all of our patients have an annual HIV test done. I'd just like to ask, you know, why you chose not to have that.
I'm married with kids. I don't see why I need an HIV test.
You know, what you're saying makes a lot of sense, but many of our patients, even our married patients, find that there's a sense of comfort and actually a sense of pride in knowing what your status is, whatever that might be. And it's always good to have that record documented in your charts.
I guess it wouldn't hurt.
You know, I think you're making the right choice, and I think you're setting a great example for your children about how important it is to take care of yourself.
Statistics show that patients, even those who decline when first asked, are much more likely to agree to an HIV test if they are asked a second time. Providers need to consider multiple factors that can put a patient at high risk for HIV. Interviewing for social history can provide critical information, especially when patients choose to opt out, and can help you brainstorm and encourage the patient to get tested. Persons with ongoing risk for HIV should be tested more frequently. These include intravenous drug users and their sex partners, persons who exchange sex for money or drugs, those whose sex partners are HIV positive, and anyone who has had more than one sex partner since their most recent test. Other high-risk population groups include anyone seeking treatment for a sexually transmitted disease and those who are initiating treatment for tuberculosis. One risk group that is also among the more challenging to incorporate into routine testing is adolescents between the ages of 13 and 17. While California law does not require them to have parental or legal guardian consent for testing or to obtain treatment for STDs and HIV, teens are often accompanied by a parent or guardian. This can pose a very uncomfortable situation for not only the teenager, who may want to have an HIV test performed, but won't do it with a parent present, but also for the parent, who may feel uncomfortable having their child being offered or accepting an HIV test. As a medical provider, you have the most leverage in situations like this.
So before we get into the physical exam, I have a few questions that I'd like to talk to her about that might be a little personal or embarrassing. Would you mind stepping out of the room for a few minutes?
Is that okay with you?
Yeah.
You want to be alone?
Yeah.
Then I'll be outside.
All right, thank you.
Although there are definite behaviors that put people at high risk for HIV infection, universal routine HIV testing is intended to screen individuals with no known risk factors who do not perceive themselves as being at risk for HIV. Knowing the benefits of routine testing can help you explain them to your patients, especially those who might express reluctance. First and foremost, early testing can lead to early treatment and the best possible health outcomes for the patient. Early testing can even detect the existence of HIV infection before symptoms develop. It can also prevent or at least limit the spread of the infection to others, especially in mother-to-child transmission. In all cases, the benefits far outweigh the costs, for you, the provider, and especially for the patient. Altamed is well equipped to care for HIV-positive patients, directing them to other services inside the Altamed system or to outside agencies as necessary. HIV is a serious and widespread medical condition. New treatment methods have dramatically improved patient outcomes, and universal opt-out testing procedures are further helping to limit its spread.